When an older loved one is diagnosed with cancer, it's not just a shock. It's the beginning of a challenging journey that requires understanding, making the right choices, and being supported by family. During this time, one of the most important things you can do is ask your doctor the right questions. You may be wondering, where do I start? Is there a treatment option that's right for my age and current health condition? Or, how can I balance treatment effectiveness with quality of life? These aren't just medical questions. They're questions that help older people feel heard, cared for properly, and live a fuller life while battling cancer. This video will give you the 5 most important questions you, or your loved one, should ask your doctor as you begin cancer treatment in your senior years. This is a guide to help you understand your condition, make informed decisions, and reduce anxiety on the journey ahead. If you are caring for an older loved one with cancer, or are in that situation yourself, don't miss this video. It could change the way you approach the disease, receive information, and most importantly, help your loved one get better treatment, live healthier, and live more meaningful lives. Question 1. Can you explain what type of cancer I have and what stage it is? When an older person receives a cancer diagnosis, it's more than just medical news, it's shock. And the first reaction of most patients is confusion, anxiety, even fear. In that moment, there's a seemingly simple but extremely important question. What type of cancer do I have, and what stage is it? Asking clearly and listening carefully to the answer to this question will lay the foundation for the entire treatment journey ahead, from choosing a treatment method, recovery, to psychological preparation and family support. Cancer is a general term for hundreds of different diseases. There are big differences between lung cancer and prostate cancer, between breast cancer and pancreatic cancer. Each type of cancer has a different progression mechanism, a different way of spreading, and a different response to treatment. Therefore, the elderly and their families should not only know that they have cancer, but need to know specifically what cancer it is: liver, stomach, lung, bowel, blood, or lymph node cancer. At the same time, determining the stage of cancer, from stage 1 early to stage 4 metastatic, will show the extent of the spread of the disease, from which the doctor can decide on the appropriate therapy: surgery, chemotherapy, radiotherapy, or palliative treatment. For older people, determining the correct stage is even more important, because the body at this age often no longer has the ability to recover quickly after strong treatment. If the disease is in the early stages, sometimes only surgery or close monitoring is needed. But if it has metastasized, the doctor may recommend focusing on quality of life, instead of exhausting radical treatment. A real-life example is Mr. Harold, 76 years old in Oregon, who was diagnosed with colon cancer. Initially, the family was only informed that there was a tumor, and worriedly requested immediate chemotherapy. But after asking the doctor to explain in detail, they learned that it was stage 1 cancer, which could be completely cured with simple surgery, without chemotherapy. Asking the right questions helped Mr. Harold avoid an unnecessary treatment regimen. In addition, understanding the stage of cancer also helps patients and their families set the right expectations. For example, if the cancer is at stage 4, meaning it is spread to other organs, treatment will aim to prolong life and improve quality of life, rather than trying to cure it. This helps patients avoid illusions, reduce psychological pressure, and have time to prepare for end-of-life decisions more proactively and calmly. When asking this question, the elderly should also ask the doctor to explain in simple, easy-to-understand language, without using too much medical terminology. You can record the consultation, ask a relative to take notes, or bring a list of prepared questions. Don't be afraid to ask the doctor to repeat or rephrase the question in a more visual way. Patients have the right to understand what their body is going through. Sometimes, knowing what they are facing is the mental medicine that helps the elderly stay calmer, cooperate better with treatment, and not get lost in the midst of complex medical options. And the first question, seemingly simple, is the key to unlocking all the information needed for an effective and hopeful treatment journey. Question 2. What treatment options are best for my age and current health status? Every cancer has one or more recommended treatment regimens, but for older people, not all options are suitable. The body at age 70, 80, or even 90 has undergone many changes. The immune system is weakened. The organs no longer function as before, along with many underlying diseases such as high blood pressure, diabetes, cardiovascular disease, osteoporosis, kidney failure, or dementia. Therefore, the second question that older people should ask their doctor is, what is the most appropriate treatment option for me? Not only medically, but also for my age and overall health status. Some cancer treatments, such as chemotherapy or radiation, can cause serious side effects: persistent fatigue, nausea, loss of appetite, weight loss, digestive upset, weakened immune systems, or heart and nerve damage. In younger people, the body can recover from these effects. But in older people, these side effects can last longer, be more severe, and sometimes exhaust the patient, forcing them to stop treatment. That's why a comprehensive evaluation before treatment is so important. Older people should ask their doctor to detail their treatment options: surgery, chemotherapy, radiation, hormone therapy, immunotherapy, or palliative care. The doctor can give a standard treatment plan, but the patient should ask, is this treatment appropriate for my condition? Are there gentler options that will still be effective? For example, an 82-year-old with early-stage prostate cancer may not need immediate treatment, but only active surveillance, because the disease is progressing slowly and life expectancy may not be affected. Meanwhile, a 75-year-old with stage 2 breast cancer, but with severe cardiovascular disease, may not be suitable for chemotherapy. Instead, hormone therapy combined with low-dose radiation therapy is recommended. This question helps the doctor consider the overall factors, not only where the cancer is and what stage it is, but also the patient's living conditions. Can they walk? How they eat and sleep? Do they have a caregiver? Are they mentally stable or depressed? There are many cases where the elderly are prescribed the same heavy treatment as younger patients, leading to serious consequences: weight loss, loss of mobility, more severe dementia, or long-term hospitalization. Meanwhile, if asked carefully, the patient may be given a lighter solution, such as taking oral medication instead of intravenous chemotherapy, or palliative treatment to improve quality of life. And sometimes, the right choice is not to fight cancer at all costs, but to live peacefully, with less pain and as much time as possible with family. This question also opens up space for the patient and family to discuss treatment goals. That goal may be to prolong life, to reduce pain, or to maintain independence for as long as possible. Only when the patient clearly expresses his or her priorities can the doctor design a suitable personalized treatment plan. Treatment is not always about doing everything possible. For older people, treatment is right when it respects the health, spirit, and dignity of the patient. Remember that you have the right to ask, the right to choose, and the right to refuse inappropriate things. And this second question is the first step for you, or your elderly loved one, to make the smartest and most humane decisions for the road ahead. Question 3. What are the side effects of treatment, and how will they affect my daily life? One of the things that older people are often not fully warned about when starting cancer treatment is how side effects will actually affect their daily life. Many older patients enter treatment without a clear picture of what they will face, and that leaves them feeling lost, out of control, and even wanting to give up halfway through. So the third crucial question older adults should ask their doctors is, what side effects will I experience? How long will they last? And will they seriously affect my ability to eat, sleep, walk, function, or feel good? Depending on the type of cancer and the treatment, from chemotherapy, radiation, surgery, to hormone or immunotherapy, side effects can vary widely. In younger people, many may experience fatigue, nausea, or hair loss for a while and then recover. But in older people, even a seemingly minor symptom, like a persistent loss of appetite, can lead to rapid weight loss, weakness, or loss of mobility. Chronic fatigue, one of the most common side effects, can leave people unable to walk around the house, unable to care for themselves, or feeling completely exhausted after just a few weeks of treatment. Chemotherapy can reduce white blood cells, leading to a high risk of infection, very dangerous for the elderly with weak immune systems. Radiation therapy to the head and neck can cause inflammation of the lining of the mouth, sore throat, loss of taste, making the patient unable to eat, quickly losing muscle and reducing quality of life. Some cancer drugs can cause temporary cognitive disorders, also known as chemobrain, making the patient confused, forgetful, or disoriented in daily activities, especially worrying for the elderly who already have signs of mild dementia. Therefore, instead of just asking which therapy is best, the elderly should ask the doctor to clearly list common side effects, the rate of occurrence, and control measures if they occur. You can also ask, if I feel nauseous, do you have any medicine to help? Or, if I can't eat for a few days, what should I do? Ask specifically, can I cook for myself, drive, walk around the house while I'm on treatment? Can I continue to see friends, go to church, garden? These seemingly small activities are qualities of life that seniors value, and they have a right to know in advance what might be affected. A real-life example is Irene, 79, from Ohio, who, after starting chemotherapy for breast cancer, felt dizzy and could not stand up in the morning. She was not warned about this. The doctor then adjusted the dose and timing of her infusion, which helped her stabilize. If she had asked more clearly about possible side effects from the beginning, she could have prepared herself and adjusted her life better. In addition, seniors should also ask if there are ways to prevent side effects in the first place. For example, changing your diet, doing light exercise, taking nutritional supplements, or taking stomach support or anti-nausea medications before each chemotherapy session. Also, ask your doctor when there are danger signs that require hospitalization, such as high fever, dehydration, excessive pain, or uncontrolled diarrhea. In short, cancer treatment is not just a medical battle, but a life journey, in which the little things like eating a good meal, getting enough sleep, walking in the garden, or keeping a smile on your face with your children and grandchildren are extremely valuable. Asking questions about side effects is not a sign of weakness. It is the necessary initiative to live better, stronger, and not be surprised by this challenging journey. Question 4. Do I need to change my diet or lifestyle to support the treatment process? For the elderly, diet and lifestyle not only affect the general health, but also play an essential role in the effectiveness of cancer treatment. This is something that is often overlooked in medical consultations, when most of the focus is on medication, tests, or treatment regimens. However, many medical studies and clinical experiences have shown that the elderly can significantly improve their resistance, recover faster, and live healthier if they know how to adjust their diet and lifestyle appropriately throughout the cancer treatment process. Therefore, a simple but practical question that elderly patients should ask their doctor or accompanying nutritionist is, how should I eat and live during treatment to help my body cope better? This question involves not only what to eat, but also what to avoid, how much to eat, when to eat, and how to stay healthy when the body is easily weakened by medication and stress. For example, during chemotherapy, many seniors lose their appetite, their sense of taste changes, or feel nauseous at the sight of food. This leads to rapid weight loss, protein deficiency, and loss of muscle mass, which is very dangerous for the elderly who are already prone to muscle weakness and poor absorption. A personalized eating plan, prioritizing nutritious, easy-to-digest foods, divided into many small meals, and adequate hydration, can help patients maintain their weight and resistance. In addition to eating, seniors also need guidance on appropriate lifestyle during treatment. Many patients think that resting a lot when you are sick is good. But the truth is that light exercise, such as walking around the house, doing breathing exercises, stretching, helps reduce fatigue, improve blood circulation, aid digestion, and keep the spirit optimistic. At the same time, getting enough sleep, maintaining a regular routine, and limiting mental stress are also factors that help the immune system function better. For older adults, insomnia or anxiety disorders can weaken the immune system and slow down the recovery process after each treatment. That is why patients should ask their doctors, do I need to avoid stimulants like caffeine or sugar? Should I meditate, listen to music, or join a psychological support group? There are many cases where the elderly are prescribed the same heavy treatment as younger patients who was diagnosed with serious consequences and started chemotherapy, loss of mobility. In the first week, more severe dementia, nearly 10 pounds or long-term hospitalization, diarrhea. Meanwhile, his family asked him more about his diet. The patient may be given a lighter solution, referred him to an oncology oral medication. They adjusted his diet to include oatmeal or palliative treatment to improve quality of life, protein shakes, and sometimes electrolyte drinks not to fight cancer at all costs. He began to live peacefully, felt less energetic, and as much time as possible with family, and was able to continue his treatment regimen. Opens up space. It is important that older adults do not arbitrarily follow unfounded diets. The goal may be to prolong life, to reduce pain, or to cutting out carbohydrates for as long as possible. Quickly weaken them. Only when the patient clearly expresses his or her priorities made in consultation with their treating physician, personalized nurse practitioner. Treatment is not always about doing everything possible. Medication is one part for older people, but daily living habits are the foundation. When the body has enough energy of the patient, the mind is proactive. Remember that you have the right to ask with you, the right to choose. The elderly will not only be more effective in inappropriate things, but also live more meaningfully. The second question is the first step for you fighting the disease or your elderly loved one. So don't be afraid to ask. To make the smartest, every meal, most humane decisions for the road ahead. Every gentle step can be part of a successful cancer overcoming strategy. And how will they affect my daily life? What support will I need during treatment? One of the things that older people are often not fully warned about when starting cancer treatment is a very important but often overlooked point when older people are diagnosed with cancer affect their daily life. They rarely go through the treatment journey alone without a clear picture of what they will face, prepared for the support they will need. Feeling lost. The truth is that cancer treatment is not just about give up halfway through or going to the hospital. So the third crucial question older adults should ask their doctors is home care. What side effects will I experience? Changes in lifestyle. How long will they last? Support. And will they seriously affect my ability to care for themselves, walk, therefore, function? One of the essential questions that older patients, depending on the type of cancer, and ask their doctors from chemotherapy is radiation. What specific support will I need during treatment, or immunotherapy services? Side effects can vary widely. In younger people, not only experience fatigue, a comprehensive picture of life during hair loss for a while, but also helps families to plan early. But in older people, from human resources, even a seemingly minor symptom to spirit, like a persistent loss of appetite, they may still drive to the hospital, weakness, and take care of personal hygiene. Chronic fatigue. For older people, one of the most common side effects can leave people unable to walk around the house, unable to care for themselves, cooking, or feeling medication exhausted after just a surgical wound clean. Chemotherapy, having someone to listen, white blood cells becomes a real challenge, leading to a high risk of infection. To explain very dangerous for the elderly with weak immune frequent hospital visits. Radiation therapy. Will someone need to pick up neck and drop off inflammation of the lining of the mouth? How will the patient feel after each chemotherapy loss of radiotherapy session, making the patient unable to eat? Someone to stay with you, losing muscle. If you have surgery, reducing quality of life. What will your recovery time be like at home? Cancer drugs can cause temporary cognitive disorders, care, also known as chemo brain, and personal hygiene. Making the patient confused. Can you eat and drink on your own, or disoriented in daily activities? Will you need a mobility aid, worrying for the elderly who already have signs of mild dementia? Therefore, special consideration for older adults in the United States, the elderly should ask the doctor to clearly list common side effects, home health care, rate of occurrence, nursing or physical therapy services at home. You can also ask palliative care. If I feel nauseous, do you have any medicine to help? Disease is advanced, or hospice care. If I can't eat for a few days, what should I do? Ask your doctor. Ask if you are eligible for referrals. Can I cook for myself? Drive and how Medicare walk around the house Medicaid while I'm on treatment. Many seniors continue to see friends that they have a right to receive medical care at home. These seemingly small activities are qualities of life who can come to their home to take their blood pressure. They have a right to know in advance, give them injections, what might be effective, give them physical therapy. A real-life example is Irene, psychological 79, from Ohio. Don't forget to ask about a mental health after starting chemotherapy for breast cancer. Felt dizzy. There are many groups and could not stand up in the morning. Such as Cancer Care. She was not warned about this. The American Cancer Society. The doctor then adjusted the dose and timing of her infusion, to help in the form which helped her stabilize. If she had asked more clearly about possible side effects from the beginning, or even providing nutritious meals and adjusted her life living alone. In addition, many seniors should also ask if there are ways when they know they are not alone in the first place. Finally, this question also opens up a much-needed conversation between the patient taking nutritional supplements, who in the family can take care of taking them to anti-nausea medication, who will stay with them each chemotherapy session, help monitor their medications. Also, ask your doctor when there are danger signs that require hospitalization. Whether you are a son, such as high fever, grandchild, or a close neighbor, excessive pain, clearly defining each person's diarrhea will help the patient feel loved. Cancer treatment is not just a medical battle, be assured when faced with a needle journey. A bout of nausea, little things or like eating a good meal. Cancer is a big challenge. Walking in the garden, or keeping a smile on your face with your journey of life, children are extremely valuable. The important thing is not how fast you go. Is not a sign of who you go with and who supports you. It is the necessary initiative to live better. Adults is not just a medical diagnosis. And not be surprised by this challenging point that can change the entire rhythm of life. Do I need to change my diet or lifestyle, and even family roles process? But it is important to remember for the elderly, age does not mean running out of options. Not only affect the general health, on the contrary, but also play an essential role asking the right questions of cancer promptly and clearly. This is something that is often overlooked in medical consultations. Minimize complications. Most of the focus is on medication, days, tests, full quality treatment regimen, dignity. However, remember that many medical studies and clinical experiences, not order makers, have shown that the elderly and their families have the right improve their resistance to participate in treatment decisions and live healthier as they know how to adjust treatment options and lifestyle appropriately throughout the cancer treatment process. Systems is how you regain control in the midst of a turbulent journey. Patients should ask if you are caring for a parent or a accompanying nutritionist or yourself entering the twilight years of cancer, live during treatment, don't let fear keep my body cope better. Take these 5 questions with you to your appointment. Not only what to eat, print them out if you need but also what to avoid. And don't be afraid to add your own. When to eat, a well-thought-out how to stay healthy conversation with your doctor weakened by medication can sometimes change the course of your example during chemotherapy. Be proactive. Many seniors lose their appetite. That's what every senior deserves, or feel nauseous and especially at the sight of food when battling cancer. This leads to rapid weight loss, protein deficiency, and loss of muscle mass, which is very dangerous for the elderly who are already prone to muscle weakness and poor absorption. A personalized eating plan, prioritizing nutritious, easy-to-digest foods, divided into many small meals, and adequate hydration, can help patients maintain their weight and resistance. In addition to eating, seniors also need guidance on appropriate lifestyle during treatment. Many patients think that resting a lot when you are sick is good. But the truth is that light exercise, such as walking around the house, doing breathing exercises, stretching, helps reduce fatigue, improve blood circulation, aid digestion, and keep the spirit optimistic. At the same time, getting enough sleep, maintaining a regular routine, and limiting mental stress are also factors that help the immune system function better. For older adults, insomnia or anxiety disorders can weaken the immune system and slow down the recovery process after each treatment. That is why patients should ask their doctors, do I need to avoid stimulants like caffeine or sugar? Should I meditate, listen to music, or join a psychological support group?